Did you know that 1 in 2 women and 1 in 4 men over the age of 50 will experience a bone fracture due to osteoporosis? I know it's a startling statistic, but don't worry. Today, we're diving into this important topic, the link between osteoporosis and bone fractures, and most importantly, what you can do about it. Stay with me through this video because I'm going to share some crucial tips, advice and knowledge that can help you protect your bones, keep them strong and avoid those painful, life-altering fractures. So let's get started, shall we? Number 1. Understanding osteoporosis. This is often referred to as the silent disease because it typically doesn't show symptoms until a fracture occurs. It's a condition where bones become weak and brittle, making them more susceptible to breaks, even from minor falls or accidents. The underlying cause of osteoporosis is the imbalance between bone resorption and bone formation. As we age, the process of bone breakdown outpaces the formation of new bone, which leads to weakened bones over time. By the time osteoporosis is diagnosed, bone density may have already decreased significantly. What makes osteoporosis particularly dangerous for seniors is its gradual nature. You may not feel the changes in your bones, but over time they become much weaker. The risk of fractures increases, particularly in areas like the hips, spine and wrists, where bones are stressed under regular pressure. Risk factors for osteoporosis include age, gender, family history and lifestyle. Women, particularly after menopause, are at greater risk due to the decrease in estrogen, which is protective for bones. Men can also develop osteoporosis, though it's less common. A history of fractures in your family can also be a warning sign. Certain lifestyle factors, such as poor diet, low in calcium and vitamin D, lack of exercise, smoking, or excessive alcohol consumption, can increase your risk. Being aware of these risk factors and understanding the gradual development of osteoporosis is the first step in protecting your bones. Osteoporosis can often be prevented or managed through lifestyle changes and medical intervention, so it's essential to stay proactive in your bone health. Number 2. The fracture. Risk 1 of the most alarming consequences of osteoporosis is the increased risk of bone fractures, which are much more likely to occur in those with weakened bones. For seniors, fractures can be more than just painful. They can significantly impact quality of life, leading to long recovery times, reduced mobility, and even permanent disability. The bones most affected by osteoporosis are those that bear weight or are subject to frequent stress. The hips, spine, and wrists are the most common sites of fractures in seniors. These bones are particularly vulnerable to breaks because they handle a lot of pressure and are prone to weakening as osteoporosis advances. A hip fracture, for instance, is one of the most serious consequences of osteoporosis. It often requires surgery and months of rehabilitation. The recovery process can be long and difficult, and for many seniors, a hip fracture can reduce their independence significantly, making them dependent on others for mobility and daily tasks. Spine fractures, although less immediately obvious, can lead to chronic pain, loss of height, and a stooped posture that can affect overall well-being. What makes osteoporosis-related fractures so dangerous is that they often happen from something as simple as a slip or a fall, events that most people wouldn't think twice about. But for someone with fragile bones, even a minor stumble can lead to significant injury. That's why it's essential to take preventive steps now to reduce the risk of falling, such as ensuring your home is free of tripping hazards and maintaining good balance and strength. Number 3. How to prevent osteoporosis. The best approach when it comes to osteoporosis is always prevention. And while you can't reverse the aging process, you can take proactive steps to maintain strong, healthy bones. One of the most important ways to do this is through a balanced diet. Calcium is a key nutrient that helps build and maintain bone strength, and you should aim to get enough of it in your diet. Good sources of calcium include dairy products like milk, cheese, and yogurt, as well as leafy green vegetables like spinach and kale. For those who are lactose intolerant or prefer plant-based diets, there are fortified options, such as almond milk, tofu, and fortified cereals, that provide calcium. Vitamin D is another vital nutrient for bone health. It helps your body absorb calcium, and without enough vitamin D, calcium won't be as effective. Vitamin D can be obtained through sunlight exposure, but many people, especially in older age, need supplements to reach optimal levels. Foods like fatty fish, fortified dairy products, and eggs are great dietary sources of vitamin D. Exercise is equally important in maintaining bone health. Weight-bearing exercises such as walking, dancing, and light jogging stimulate the bones and help maintain bone density. Even low-impact activities like walking or water aerobics can be incredibly effective. Exercise helps not only to strengthen bones, but also to improve balance and coordination, which can significantly reduce the risk of falls. Additionally, maintaining a healthy weight is essential, as both underweight and obesity can increase the risk of bone loss and fractures. Limiting alcohol consumption and quitting smoking are crucial steps to take to protect bone health, as both habits can negatively affect bone density. Number 4. Medication and regular checkups. While lifestyle changes like diet and exercise can go a long way in preventing osteoporosis and fractures, some individuals may need additional help. In some cases, medications are necessary to slow the progression of osteoporosis or to stimulate bone growth. These medications come in many forms, from oral pills to injectable treatments, and your doctor can guide you in finding the right one based on your specific needs and health conditions. Bisphosphonates are one of the most commonly prescribed medications for osteoporosis. They work by slowing down the rate at which bone is broken down, which helps to maintain bone density. Other medications may include hormone therapy, selective estrogen receptor modulators, SERMs, and even newer treatments like monoclonal antibodies. Each of these treatments has its benefits and potential side effects, so it's important to have a conversation with your healthcare provider about what's right for you. Regular checkups are crucial to monitoring your bone health. One of the most effective ways to catch osteoporosis early is through bone density testing, which measures how strong your bones are and whether you're at risk for fractures. Bone density scans are quick and painless, and they can give you an early warning so that you and your doctor can take action to prevent fractures before they happen. If you've already been diagnosed with osteoporosis, regular monitoring is essential to adjust treatment plans and ensure that your bones remain as healthy as possible. Make sure to stay on top of follow-up appointments and discuss any changes in your bone health with your doctor. Number 5. The power of prevention. The key takeaway here is that osteoporosis doesn't have to control your life. While it's true that age, gender, and family history can increase your risk, there are many things you can do right now to protect your bones and reduce your chances of a fracture. Prevention is powerful, and it starts with small, consistent habits that make a big difference over time. First, focus on diet and exercise, two of the most impactful factors when it comes to bone health. Ensure you're getting enough calcium and vitamin D to maintain strong bones. Incorporating weight-bearing and balance exercises into your daily routine will help you not only preserve bone density, but also enhance your ability to move safely and confidently. Second, be proactive in talking to your doctor about your bone health. If you haven't yet, schedule a bone density test and discuss options for supplementation or medication if necessary. Regular checkups are essential in keeping osteoporosis in check and preventing fractures. By taking these simple yet powerful steps, you can dramatically reduce your risk of osteoporosis-related fractures and live an independent, active life. So, start today, whether it's by taking a walk, adding more calcium-rich foods to your meals, or making that appointment with your doctor. The effort you put into bone health now will pay off in the years to come. Now, I'd love to hear from you. What steps are you taking to protect your bone health? Have you tried any of these tips? Drop a comment below and let me know. And as always, don't forget to like this video and subscribe for more advice that can help you live a happier, healthier life in your golden years. Remember, taking care of your bones today can keep you strong and independent tomorrow. Thanks for watching, and I'll see you in the next video.